Good evening, everyone. I believe addiction is not a very interesting topic, but I would like to thank you for staying here at this hour. I'll be talking about some experiences, indeed. There are some theoretical parts, but Melike and Kurtegin already mentioned about those things, so I will skip that part, and I realize that my time is quite limited. That's why I will be talking about some practices and experiences. Addiction is quite difficult. It's a long period to have the recovery, and this is a way that you need to follow, and it's somehow long, yes. And there should be psychosocial support as well. And in AMATEMS, generally, it is a detoxification treatment. It is like the first step of rehabilitation. However, in the long run, we couldn't provide an extra support in AMATEMS, but Ministry of Health and Green Crescent worked really hard on this rehabilitation. They had site visits. We also do have site visits. Nearly 60-70 centers have been visited in different countries, and we had this good country examples. So there are lots of models in the world. It could be outpatient, inpatient, and really different ones. It's from a very minor center to a luxury hotel concept rehabilitation centers. So we try to create a model for our needs which could be compliant with our resources as well. And in Ministry of Health, there is a rehabilitation center model, and it is called as Bahar, which is spring in Turkish. And it is promising, and we have just started. It's nearly 15 to 16 months that the Spring Center is running. What is our practice here? This is a picture from Bahar. This is the center of rehabilitation for addicted patients, and there is a very small building. We do not need a big premise for that. For example, some workshops, studies could be held in this center. I believe 350 meters square is used for that center, and it is open on January 2nd, 2018. We just discussed should it be outpatient or inpatient, and the more that you have the options, the more patients that you can reach indeed. Of course, you need to have some inpatient facilities, but also you need to have outpatient facilities as well. So we tried both. As Erenköy Spring Center, it is an outpatient center. We call them as members, not patients. They just visit us in the morning. They have a certain schedule to follow, and then they turn back to their homes. And there we do not have this big team, and we do not need that big team indeed. We have one psychiatrist, one clinical psychologist, 2 nurses, 1 social worker, and 1 assistant staff, and job trainer instructors. So for bipolar patients, TSMR model is adopted to be used here, and in bipolar it really worked quite well. So this is somehow the revised version of it, but some also a bit different as well. And a municipality indeed supported us, and World Bank provided financial sources to establish here. It is not like a healthcare center, but like a social center, a cafeteria, for example. And we would like to welcome you all there. It is quite cute. who are welcomed here, who do not take drugs at least 3 weeks. The volunteers are accepted, and they are called as Bahar member. We just need their they're being voluntary for that, and we followed a model for 6 to 7 months. And Kültekin also talked about this community-based treatment, and we have an idea on that in Imraniye. And every case has a consultant, and that consultant dealt with every single problem, social problems, family problems, having interviews with family. If there are any problems with accommodation, for example, they were dealing with that as well. And that consultants were calling the person when they didn't show up. And every case were handled by one consultant. And after a while, we started to take supervision. And Talat Parman was our supervisor. It is kind of a different approach, point of view. And upon his recommendation, he stated that you try to handle everything, the inner soul of it, the social problems and addiction. It is quite difficult for one person to deal with everything. And now we have clinical psychologists. That therapist is only responsible from that therapy for 45 minutes, and there are no other duties for that person. And psychiatrists only take care of the medical treatment. And there are some, for example, morning meetings, sharing groups, film screening, and group activities. And the social worker deals with that. The nurse, for example, again. Psychologists do not take care of that person's attendance to the center. They do have only one duty, which is to provide that therapy. So it is a very well-framed system, and social worker deals with the problems with the center, and we do believe that this is much fruitful system for our center, and we would like to share the data in near future, we hope. And in Bahar, we have some experiences. For example, we have a hobby trainer. The ones who enjoy it, it is like a drawing class. But there are different types of people having hearing impairments or the elderly. We had Spanish courses, we had this painting classes, very, very different, and we have very individualized trainings. It is not like a group will take this course now and then this course. It is an individualized system, and even with 2 people we perform those classes. We have 2 members who completed their first year, and those people get also training from a community center. They will be senior trainers, and they are role models now for other members. And as well, there are sports activities and social cultural activities. It is not like, again, let's visit this place this week, but in a year run, we had this correspondences with Ministry of Culture, and we have a program now. And our members, do you know that if they would like to visit those places, they can go, or together with their families, they can go and have this social activity and cultural activity, for example. And also for memory, language, we have computer-based systems as well. A nurse is taking care of this in order to improve the memory language development exercise class. And other than that, we have hobby hours. But I believe the most effective, fruitful thing for us that we established a multidisciplinary visit system. All these listed activities, organizations are now officially responsible in that center because we have sent official letters for their participation, and with U-shaped classroom we are talking about our activities. This is our approach, this is what we do so far, but the outcomes are not that satisfying. Not regarding the psychiatric outcomes, but for some social aspects, we ask their help. It could be accommodation, it could be employment, and some of our members couldn't get their diploma, for example, to be a senior trainer. And at that point, we just referred that people from other organizations, public organizations, to ask their help to provide that diplomas. So they were included in the training system. And for example, this is a weekly program. We do not have this approach. We have this program and everyone will follow that. Everyone just comply with this program in their own capacity. For example, in scenario script writing atelier, we have quite creative ones, and lots of other options are also available for the members. And we have this targeted gains at the end of the first 3 months. And we have 3 to 6 months targets and 6 to 9 months. We are trying to create a scale. They're giving scores for themselves. The first 3 months is very basic to be able to learn and apply group rules. They will be on time and be open to cooperation with the treatment team, for example. And for the next 3 months, it is to perform responsibilities given outside the center, to be able to develop family work and social relations, and every point is evaluated in their own way and separately. And also healthcare professionals do score those people, and generally the individual, the member, gives lower scores for themselves, and we say you're being unfair to yourself and you need to be fair. And we have this double check because of this reason. And members of the Spring Center, it is mostly like a school rule. It is to tell a student, for example, they take care of arrival and departure times at the center. They notify when they cannot come to the center. They take care to protect privacy, etc. And it is not like you will be punished for doing that, but it is the approach of we are doing this in that way, and they have certain rules to follow. And as a result, for the last 15-16 months, by the way, there are no reimbursements from Social Security system, and a voluntary team provides the services, and we couldn't get any reimbursement. And just before coming here, I had a meeting in the Ministry of Health. We shared all this data with them, but in return of this service, our state haven't hasn't provided just 1 lira. This is somehow embarrassing, I believe, and we are quite late to provide these services, but I believe there will be some improvements in the system. And in 1 year we had 48 regular members in the center. 27% of those started to work, 12%, 13% had relapses, 46% of them are still ongoing, are in the center. Just 1% was just ruled out from the system because he was insisting on using this drug, and we stated that if you're incompatible with the system, then you're ruled out, unfortunately. The ones having relapses, it is Amatem first and then the Bahar Spring Center. This refers to 13% of people. And infectious diseases polyclinic, some of them has Hep C positivity. Nearly now we have a total cure for Hep C positivity, and there are lots of full remission patients. And as well, in Bahar Center, nearly we have completed all the materials, and we are about to open our new center in Üsküdar, and we will have an inpatient center. Arzu is here, who is the architect of that center. They had a project with Istanbul Metropolitan Municipality, and ours is working in Bakırköy. Managing this center could be quite difficult, but the support team was provided from our center. Our treatment team and our ZUS coordination helps to run this center. Tuzla Spring Center is opened 1st of March 2019, and we have 3 and 6 months program. Indeed, in this time period, we are also learning things. We just come across some unexpected issues and information. So this process brings us to a higher level in terms of information and experience. And this center is also designed in a very chic way. So Arzu has done a quite good job. The rooms are just like a hotel. And the last thing that we performed with these multidisciplinary visits, İşkur representative stated that we have completed the programs for some of our members, but we couldn't get employment for them. But we needed that. And İşkur, the employment center in Turkey, gives us 20 codes. And we managed think that this is the best part, most probably, in that time period. I believe I added that part to my ministry presentation, but forgot about this one. These 13 people who completed their rehabilitation of 6 months program, then we put them to an employment program. Think about that this center requires a person who will clean the garden, or for correspondences, for example, for delivery purposes. We need some people. I wasn't involved in the process, but because I was in the treatment group. However, we have stated that we could need some other people, but the ones who are employed in this stage is not with the purpose of having some contributions, but in that employment process, we had difficulties because administrative part thought that they could get some benefit, but we had this one protest member of management. We put him or her into the patient rights desk, and he has this protest approach, so we do not hear any complaints about patient rights. And the one who has a quite good pronunciation is on call center, for example. And one lady, Chida, in another service, the invoicing group, she has stated that I would like to contribute this period, and I want to have one person to train it. And one is trained in public relations. They are using the same restaurant with us. If you visit our center now, you can't differentiate the members and the administrative part or the employees of that center. But they visit us in the morning and they have this good morning meeting first. If they do have therapies, then they have the allowance, they are allowed to go to that therapy. And at the end of the day, we have this closing session. So they follow this program, but we have this 3 to 6 months programs only, and we are having meetings to discuss what could we do after that 6 months, how to supervise those people. And as a women administrator, I really would like to have a center which is accessible for pregnant women, for example. We had visited a place from the United Kingdom. This is the UK Mother and Baby Units who has chronic diseases, and it is all over the country. This is one of our problems. We do not have such centers. From Vienna, we had Gabrielle Fischer indeed, and we had supervision from her. We are about to complete a program, and we worked on every single need of those people, and we do believe that this addicted women who has a child or pregnant could stay in such centers to be connected with the treatment. And I would like to thank you for your nice attention.